Fundamentals of Nursing Beginner Practice Questions. Question 1. Which of the following statements about chest X-rays is false? There are contraindications for this test. Before the procedure, the patient should remove all jewelry, metallic objects and buttons above the waist. A signed consent is not required. Eating, drinking and medications are allowed before this test. The correct answer is A, because there are contraindications for chest X-rays such as pregnancy or concerns about radiation exposure. Question 2. When is the most appropriate time for obtaining a sputum specimen for culture? Early in the morning. After the patient eats a light breakfast. After aerosol therapy. After chest physiotherapy. The correct answer is A, early in the morning, because sputum accumulation is naturally highest after a night of sleep due to prolonged stasis of respiratory secretions, which allows for a more concentrated and representative sample of pulmonary flora or pathogens. Question 3. A patient with no known allergies is to receive penicillin every 6 hours. When administering the medication, the nurse observes a fine rash on the patient's skin. The most appropriate nursing action would be to withhold the medication and notify the physician. Administer the medication and notify the physician. Administer the medication with an antihistamine. Apply cornstarch soaks to the rash. In this scenario, the appearance of a rash after administering penicillin, even in a patient with no known allergies, is concerning for a potential allergic reaction. Question 4. All of the following interventions are correct when using the STRAC method of drug injection, except: prepare the injection site with alcohol. Use a needle that is at least 1 long. Aspirate for blood before injection. Rub the site vigorously after the injection to promote absorption. When using the STRAC method of drug injection, it is important to prepare the injection site with alcohol to ensure cleanliness. Use a needle that is at least 1 long to reach the muscle tissue, and aspirate for blood before injection to verify correct needle placement. Question 5. The correct method for determining the vastus lateralis site for IM injection is to locate the upper aspect of the upper outer quadrant of the buttock about 5 to 8 centimeters below the iliac crest. Palpate the lower edge of the acromion process and the midpoint lateral aspect of the arm. Palpate a 1 circular area anterior to the umbilicus. Divide the area between the greater femoral trochanter and the lateral femoral condyle into thirds and select the middle third on the anterior of the thigh. The correct answer is D, because the vastus lateralis muscle is located in the anterior thigh, and the described method ensures proper localization for a safe intramuscular eye. Question 6. What is the appropriate needle size for insulin injection? 18G1 long, 22G1 long, 22G1 long, 25G58 long. The correct answer is D, 25G58 long, because insulin injections are typically administered subcutaneously into the fatty tissue beneath the skin, and this needle size is optimal for such delivery. Question 7. What is the appropriate needle gauge for intradermal injection? 20G, 22G, 25G, 26G. The correct answer is D, 26G, because intradermal injections require a fine short needle to deposit medication or vaccines just below the epidermis without penetrating deeper tissues. Question 8. Parenteral penicillin can be administered as an IM injection or in 4 solution. 4 or an intradermal injection. Intradermal or subcutaneous injection. IM or a subcutaneous injection. Parenteral administration refers to delivering medications via routes other than the digestive tract, typically involving injections. Question 9. The physician orders 10 gr of aspirin for a patient. The equivalent dose in milligrams is 0.6 mg 10 mg 60 mg 600 mg. The correct answer is D 600 mg because 1 grain gr is equivalent to approximately 64. Question 10. The healthcare provider orders an 4 solution of dextrose 5 in water at 100 ml. What would the flow rate be if the drop factor is 15 gdt 1 ml 5 minute, 13 minute, 25 minute, 50 minute? To determine the flow rate in drops per minute, multiply the ordered volume per hour by the drop factor 100 ml x 15 gtt ml 1500 hour. Question 11. Which of the following is a sign or symptom of a hemolytic reaction to a blood transfusion? Hemoglobinuria, chest pain, urticaria, distended neck veins. Hemoglobinuria is a characteristic sign of a hemolytic reaction to a blood transfusion. Question 12. Which of the following conditions may necessitate fluid restriction? Fever, chronic obstructive pulmonary disease, renal failure, dehydration. Renal failure often necessitates fluid restriction to prevent fluid overload. Question 13. The nurse observes that Mr. Adams begins to have increased difficulty breathing. She elevates the head of the bed to the high Fowler position, which decreases his respiratory distress. The nurse documents this breathing as tachypnea, eupnea, orthopnea, hyperventilation. Orthopnea is a condition where a person experiences difficulty breathing when lying flat but finds relief when sitting up or standing. Question 14. The physician orders a platelet count to be performed on Mrs. Smith after breakfast. The nurse is responsible for instructing the patient about this diagnostic test, writing the order for this test, giving the patient breakfast. All of the above. The nurse's responsibility in this scenario is to instruct the patient about the diagnostic test ordered by the physician. Question 15. Mrs. Mitchell has been given a copy of her diet. The nurse discusses the foods allowed on a 500 mg low-sodium diet. These include a ham and Swiss cheese sandwich on whole wheat bread, mashed potatoes and broiled chicken, a tossed salad with oil and vinegar and olives, chicken bouillon. The correct answer is B, mashed potatoes and broiled chicken. Question 16. The physician orders a maintenance dose of 5,000 units of subcutaneous heparin and anticoagulant daily. Nursing responsibilities for Mrs. Mitchell now include reviewing daily activated partial thromboplastin time APTT and prothrombin time, reporting an APTT above 45 seconds to the physician, assessing the patient for signs and symptoms of frank and occult bleeding. All of the above. The correct answer is D. Question 17. The 4 main concepts common to nursing that appear in each of the current conceptual models are person nursing environment medicine, person health nursing support systems, person health psychology nursing, person environment health nursing. The correct answer is D because it accurately reflects the 4 meta-paradigm concepts universally recognized in nursing theory: person, environment, health, and nursing. Question 18. In Maslow's hierarchy of physiological needs, the human need of greatest priority is love, elimination, nutrition, oxygen. In Maslow's hierarchy of needs, physiological needs form the base of the pyramid, representing the most fundamental requirements for human survival. Question 19. When a family of an accident victim who has been declared brain dead appears open to organ donation, what should the nurse do? Discourage them from deciding until their grief has eased. Listen to their concerns and answer their questions truthfully. Urge them to immediately sign the consent form. Inform them that the body will not be available for a wake or funeral. When a family is open to organ donation after a loved one has been declared brain dead, the nurse's role is to provide compassionate, honest and non-coercive support while addressing their concerns. Question 20. A new head nurse on a unit is distressed about the poor staffing on the 11 p.m. to 7 a.m. shift. What should she do? Complain to her fellow nurses. Wait until she knows more about the unit. Discuss the problem with her supervisor. Inform the staff that they must volunteer to rotate. In this scenario, the new head nurse should discuss the problem with her supervisor. Question 21. Which of the following principles of primary nursing has proven the most satisfying to the patient and nurse? Administer oxygen by Venturi mask at 24 as needed. Allow a 1-hour rest period between activities. Patients and nurses both respond well to primary nursing care units. Studies have shown that patients and nurses both respond well to primary nursing care units. Primary nursing care units have been proven to be highly satisfying for both patients and nurses. Question 22. Which of the following principles of primary nursing has proven most satisfying to the patient and nurse? Continuity of patient care promotes efficient and cost-effective nursing care. Autonomy and authority for planning are best delegated to a nurse who knows the patient well. Accountability is clearest when one nurse is responsible for the overall plan and its implementation. The holistic approach provides for a therapeutic relationship, continuity and efficient nursing care. The holistic approach encompassing a therapeutic relationship, continuity and efficient nursing care is the most satisfying principle of primary nursing. Question 23. If a healthcare provider administers an injection to a patient who refuses, they have committed assault and battery, negligence, malpractice, none of the above. When a healthcare provider administers treatment such as an injection against a patient's refusal, or will it constitutes assault and battery? Question 24. If a patient asks the nurse for her opinion about a particular physician and the nurse replies that the physician is incompetent, the nurse could be held liable for slander, libel, assault, respondent superior. In this scenario, if the nurse makes a false verbal statement about the physician being incompetent, it is considered slander. Question 25. A healthcare provider reaches to answer the telephone on a busy pediatric unit, momentarily turning away from a 3-month-old infant she has been weighing. The infant falls off the scale, suffering a skull fracture. The healthcare provider could be charged with defamation, assault, battery, malpractice. The scenario described involves a breach of duty by the healthcare provider to properly supervise the infant, resulting in harm.